everybody was very proud that I had become a doctor and now I could help people. So I used to get a lot of calls from my friends and family saying somebody's had a heart attack or somebody's had an accident, somebody's had a head injury, and could I help them? And of course I felt very proud that I could help, and I would say yes, of course, why not, come over and I'll get a bed for you and arrange everything here. Sometimes I would keep waiting for them for a very long time. The next day when I would call them, I would get to hear that, that patient had died on the way in the car, so we just turned around and came back to our village. These were the stories that I kept hearing again and again and again. I kept wondering what I could do to solve all these issues. Based on these personal stories and interactions and family experiences, the concept of these hospitals in small towns came about. One small clinic then became one hospital, then we opened 3 more, then more investors came in, and now we have 15 of these hospitals spread across 4 states of North India. So all of these hospitals are approximately about 100 to 200 beds each. We are very conscious of the fact that if you're making something which is fit for poor, it need not be poor quality. So we set up NABH accredited high quality hospital with all the facilities that a big city hospital should have and would have at approximately 10 to 15% of the cost that it would for any other bigger organization. We also work on very low costs on the out-of-pocket part. The problem is people in India save for education, they save for their marriages, they save for feasts, but nobody saves for an illness. And this health shock brings more than 6 crore people below the poverty line every year just due to healthcare costs. We can operate most of the surgeries for you at a flat 10,000 rupee cost, so it includes everything. The deliveries can be as low as 2,000, 2,500 rupees. And of course, if you have third-party payers for you who are paying, like if you are in a government organization and that pays, or if you have a private insurance with a TPA paying for you, then we'll take whatever the rates set by those organizations are. And this is why we love Ayushman Bharat so much, and we've been the champions of Ayushman Bharat because most of the people that could not pay at all earlier now have Ayushman cards. We treat more than 2 million patients every year.
The Ayushman Bharat Yojana, India's universal health coverage scheme, aims to provide free medical treatment to over 50 crore underprivileged citizens. It covers all costs for over 1,600 medical procedures at empaneled government and private hospitals. Organizations like Ujala Cygnus have been able to treat poor patients under the scheme, hence saving them lakhs of rupees in medical expenses.
In the bed right next to where I am is a 28-year-old patient undergoing dialysis, and he comes from more than 50 kilometers away to get his dialysis done twice a week just because he has an Ayushman card, and there is no hospital close to where he stays which offers him free dialysis.
Ujala Cygnus follows the mantra, prevention is better than cure. It runs a network of outreach clinics or SEHAT clinics in villages around its hospitals. The aim is to spread awareness and catch illnesses early to prevent hospitalization. Each week, over 70 SEHAT clinics are set up to serve 200 to 300 people on weekdays and thousands over the weekend.
To promote healthcare and to make sure that the costs of the disease are really low, we need to go into the villages and work with them. Our SEHAT clinics are situated in small villages and kasbas around our hospitals where an MBBS doctor sits the whole day. We have a pharmacy, we have laboratory services, we have an X-ray there, so that we can take care of most of the small things and the primary care of that community before they become complicated, and so that they do not have to come to the hospital at all. In our hospitals, we get a lot of people with complicated diabetes. So in every camp, we detect almost 5 to 10 new diabetics who had no idea that they were suffering from diabetes, and their blood sugars are way through the roof. And imagine we are holding about 70 camps every week. So 10 camps every day. So imagine how many new diabetics we are detecting. The geography that we are present in, all of North India, very small towns, villages, it's unfortunately a very deeply patriarchal society. So getting the women out of their houses and seeing their issues, they're so shy that they won't even talk about their issues even if they're very ill. So we make sure that we bring a lot of women into our camp. The COVID pandemic was as different in the first 2 waves as chalk and cheese. We realized that we had completely lost touch with the community. We didn't know how to get in touch with them, how to manage their chronic disorders. And then we started our digital health solution within 2 days. In the first month during that lockdown, we were doing as many as 35,000 teleconsultations per month. And this helped us stay in touch with the community. The second wave, of course, was an entirely different story. It came in like a tsunami and flattened all of us. Delhi was one of the most affected geographical regions. It was reeling under the wave. So the Delhi government wanted to add more beds very quickly. Within 7 days of that conversation just starting off, on 1st of May we had inaugurated this Buradi Jumbo Center with 1,000 oxygen beds in it. However much we may speak of primary healthcare and preventive healthcare, the unfortunate reality is that these kinds of complications will keep occurring and we will keep needing all these tertiary care facilities for a long time to come. We have a population that is extremely young right now, but they will get older, and when they do get older, the facilities that we have currently will fall way short of what will be needed in the next 10 to 20 years.